Well, I'm Dr. Silvia Corral, and I am speaking to you from California in the United States. And I just want to thank you for inviting me, Victor Expo, to be part of this. I'm excited. I think having these types of events in Africa and reaching all the women that need to hear these kinds of messages is so important. And I applaud your efforts. I am a breast cancer survivor as well as a doctor, so I'm going to try to bring in both perspectives, and I work with cancer patients. I have some slides, and let's see if I can share them with you. Victor, you need to let me have screen sharing. Okay, all right, let's see. It's not coming. It's okay. I will do this without screen sharing. So today I was going to talk about survivorship care plans, although the last viewer was quite good at showing you and talking to you about survivorship care plans. Okay, here we go. I've just been given a screen share, so let me share my screen. All right, here we go. There we go. Don't you love technology? Here we go. So, can you guys all see my screen now? Yes, right? Okay, so the last speaker talked about survivorship care plans, but I'm going to try to answer a couple of questions. One, what are they? Why do we have them? Do they work? And then also my personal experiences with survivorship care plans, dealing specifically one-to-one with certain clients, patients, and myself. So a survivorship care plan is a record of your cancer treatment and the history. And it should include your checkups and follow-up tests that you may need in the future, the effects of your treatment, and recommendations for staying healthy. Another way to say it, it's a detailed plan that they give to you after your treatment ends. It contains a summary of all your treatment, what your cancer is, as well as recommendations for what needs to happen next. Most of us, when we finish our cancer treatment, I call it that we start our new normal or our life after cancer. I don't think that most people understand that, especially women with breast cancer, you try to go back to the way things were, and I'm sorry, you can't go back. You can only go forward and build a new normal for yourself. So how did these survivorship care plans come about? Well, in 2005, the Institute of Medicine came out with a very big report. It was called From Cancer Care in Transition. And basically, it discovered that here we were finishing our cancer treatments, and then boom, you're done. And you were lost to follow up. And because of that lost in transition, we weren't having very good outcomes. People didn't know what to do. They didn't know what to screen. They didn't know who was responsible for taking care. So they identified a need for a new kind of treatment called survivorship care, the delivery of health services designed for cancer survivors. And this would include prevention of new cancers, looking for recurrent cancer, identifying the late effects of cancer treatment, interventions for illnesses secondary to cancer and cancer treatment, and most important, coordination between the doctors who see you at home, at your local level, and the professional. So it was so important that ASCO, as presented by the last provided speaker, started a task force and a committee, and they defined survivorship care. They developed templates for survivorship care plans. They have guidelines of what survivorship care should include. They developed a teaching curriculum for survivorship care, and all these tools for building and implementing a survivorship care plan. There were other organizations that you can also find survivorship care plans, including Live Strong and Journey Forward. So there's all this effort going into these survivorship care plans, and they were attached to being able to get money from the government. So people really tried to implement this. But we did not meet the goals, because the goals were to promote patients to engage with their doctors. It was to increase the knowledge of the treatments received and recommendations for screening. And what ended up happening most of the time is people got a piece of paper and said, okay, here's your survivorship care plan. And it isn't working. So why continue to do it? And that's because we as cancer survivors are a different kind of patient. We have higher risk of recurrence. Once you have cancer, you have a higher risk of other cancers. We have late occurring effects, especially with the drugs that we are taking early in, even for early breast cancer, like neuropathy, heart disease, osteoporosis. And in all the studies that have been done looking at chronic illness like high blood pressure, stroke, heart disease, if you have had cancer, you actually don't do as well unless you work harder to prevent that disease or control that disease. We die earlier from all of those chronic illnesses. And here is ASCO's statement: the growing population of cancer survivors and a shrinking workforce. That means there's not enough doctors, radiation oncologists, nurses, everybody working in cancer, and a disjointed healthcare system. The challenges for our cancer survivorship community are only going to increase. And all of these things that I talked about, new cancer, heart disease, neuropathy, psychological impairment, anxiety, depression, fear of recurrence, they are also increasing. So even when we're cured, our overall survival, our overall sense that we are healthy and that we can live long lives is not the same as another person who doesn't have cancer, who is our same age. So what were the barriers? Why couldn't people implement these survivorship care plans? Such a great idea and an important thing. So why? One, it was time consuming. Two, who was supposed to do it? Was it the doctor? Was it the nurse? Was it the nurse navigator? Was it the radiation oncologist? Nobody knew who exactly was supposed to do this care plan. And why didn't anyone get assigned to it? Because nobody is paying for it. It is something that should be done, needs to be done, but no one is paying for it to be done. So what did happen was people did some studies, and they found that in Canada, they did a study, and there were no differences in cancer-related distress, quality of life, patient satisfaction. And another one said it only decreased health worries, but there were no differences in terms of the person's feeling of healthiness. And another study looking at women with ovarian and cervical cancer, again, showed no differences in patient-reported outcomes. And I'm going, wait a minute, no differences? There's something wrong with the tool. The idea is important, but something's wrong with the tool. So they did a study of 11 different cancer centers that were doing survivorship care plans. And what they found, looking at, see, to me, I have a master's in public health, is to having a tool that I can give to you, and you are able to use that tool to educate yourself to promote your own health. If I give you a tool in which you are not able to understand it, interpret it, use it, then there's an imbalance between the tool and you, and that's called health literacy. So when they looked at the health, what level of English would you have to have in order to use the survivorship care plans and understand them? Most of the survivorship care plans demanded that you have a high school or college education in order to understand that. So I don't think most of the Americans that have breast cancer are college educated. Breast cancer is a democratic disease. It affects everybody. So this to me is a real barrier to be able to use care plans effectively. So there was one study that combined two elements of survivorship care plan, which is providing information and then providing empowerment. This trial was done in Los Angeles with a group of medically underserved breast cancer patients, primarily Mexican American, Spanish speaking. And they hypothesized that because there were more needs among this underserved population, that a survivorship care plan would have more of an impact. So they developed a tool. They took the survivorship care plan from Journey Forward and then adapted it to the population and made it one page and made it quite simple. The first section over here is called follow-up care. And it says, are you going to have problems with bone health, depression, hot flashes, weight gain? Did you gain weight? Are you afraid of recurrence? Do you have any problems moving your shoulder? Do you have lymphedema? Are you tired? Do you have any problems with fertility? Do you want to have children in the future? How is your anxiety? How are you sleeping? How about joint pains and aches? And it goes through a list of many of the side effects that women with breast cancer have or will have, and it helps people check them off. Are you worried about this? And then this other section is called the treatment summary, and it puts down all the important things that every woman with breast cancer should have available about their treatment. Family history. Did you get genetic testing? What breast was affected? Did you get node biopsies? Did you get an axillary dissection? What was the final tumor stage? After they did all of their work, what tumor stage were you given? What was your estrogen receptor status? What was your HER2 status? Were there other special tests that helped identify your breast cancer? Was it special with other markers? Did you get breast reconstruction? And most importantly, where were all of this done? The empowerment part was after they did the summary, they met again with the participants and said, okay, now you have all of this here. This is your plan. I want you to write down the 3 most important questions that you have about your care plan. And then they did role playing. They said, okay, pretend you're going to go talk to your doctor. How would you ask him or her about this? How would you present this? And they role played back and forth. Then they encouraged each woman to make an appointment with their physician. And they sent a copy of the care plans to their physicians to prepare them for their visits. And I call that empowerment. And what happened? Okay, those other studies didn't show any improvement. But guess what? This study saying simple information with a process of empowerment, of empowering women to understand their tool and ask questions, there was greater physician implementation of the survivorship care plan. And there was greater satisfaction of the patient and the physician. To me, this tells us that survivorship care plans play a very big role in our next life, in our new normal, in our life after cancer. I want to tell you a quick story of how it can save your life. There was this woman who was part of our group, and she completed her 5 years of treatment. And then this was an educated woman, a very educated woman, a realtor. And she completed her treatment, 5 years of treatment. Oncologist said, okay, you're done. No more cancer. Go out and live your life. And she did. And in a year, she started having bone pains. And, she did a lot of Advil and treatment, and then went to urgent care when it was getting worse. They told her she had costochondritis, and she said, okay. And they kept giving her more pain pills. She went to urgent care 3 times. And on the 4th time, they finally did some x-rays, and she had metastases. The cancer had come back. Now, she wasn't expecting it. She didn't mention, the importance of thinking about, something happening because of the breast cancer to all the doctors that she was seeing. She was seen 3 times before. And then when they told her she had bony metastases, nobody said, okay, you need to get in with your doctor right away. She had a son that was going to go to college, and she had to help him finish out her paperwork. So she waited 3 months. When she finally did get in, it had already gone to her brain. And she died 3 months later. And to me, that is tragic, because the absence of a survivorship care plan, her knowledge that even though you're finished with treatment, you still are a cancer patient and you have certain risks. You need to be aware. You need to be able to inform the doctors who are taking care of you in urgent care, in emergency rooms. Could this be connected to my breast cancer, or to the drugs I'm taking, or to the treatment I have. Here, let me show you what I've had. And it gives you an opportunity to be your own advocate. My final words are, it's your life. You are responsible for it. The doctors and the medical care system are there to help you, but it's you who are responsible for it. They're important summaries. They can save your life. So be your own advocate. Ask for copies of your records, copies of your tests. Get a folder, a binder, put them all in there. Encourage your clinics to develop survival documents like the one I showed you. And understand when you leave and they say, okay, you're done with treatment, what do you need to do after treatment to stay healthy and decrease the risk of recurrence? There's a lot of information out there for that. There are advocates, there are organizations, there's Empress Pink now in Africa. There's online networks available. But I think the most important thing is you as a patient who has had breast cancer or a caregiver of someone with breast cancer, become your own advocate. It is so important. I'm a doctor and I can't take care of people unless they help me take care of them. I'm a patient, a breast cancer survivor, and I need to know what happened to me in order to be an advocate for myself in a very complicated medical care system. So I welcome your questions, and I hope that you have a wonderful seminar here for all of you. And I thank you very much.
Thank you very much, Dr. Silvia. We appreciate you. I have heard so much in less than 15 minutes. And I have like 1,000 questions, but I'm going to leave the floor for every other person to ask their questions. So if you have a question online, you're online, put your hands up. If you're in the physical space, inform the Secretary General of Pink Africa to, yes. But my question to you is there a hospital we can shadow to put us through the survivorship care plan so that we can take it step by step? How can we as Pink Empress, come in to help the patients in Africa? Can you refer us to a group who's had it going for them, and we can, maybe go take a few trips, go and understudy them or work with them virtually to have it going for our patients? Because life after cancer is the most important thing for us, for those who have finished, their treatments as cancer survivors.
I love the question. And you have just challenged me to answer the question. I don't have an answer right now, but I will find an answer for you. I have a list of survivorship care plans and institutions that have instituted those. And I think it's a wonderful to do for me, and I would be happy to provide that for you.
Thank you so much. We are in your debt, and we're ready to work with you as long as you're ready to work with us. Please guide us, because this is new for us. We don't really know how to go about it, and we'll appreciate it. Thank you.
You're very welcome. I want to tell you, I have a very special place for Africa in my heart. I have worked in Kenya several times, and I've also gone to Malawi for malaria issues. So, all I know is Jumbo.
We're glad to have you on board. Thank you very much. Thank you. A round of applause for our speaker. I learned so much. Any other question? And then please, Ma, before you go, can you say something about, what do they call this? Breast reconstruction? Because I have currently in one of the major hospitals, a 20-year-old level 2 university student who has breast cancer. And I promised if she would allow treatment to commence, I think it was in Dr. Adewale's office. I promised that little girl that was going to ensure that she has a breast reconstruction. So if she needs to pay so amount of money, I will muscle support for half the cost. So we need to know if there are organizations that can partner with us in Nigeria to have breast reconstruction. In 2020, as Pink Africa Foundation, during the heat of the COVID, it enabled us to expand our reach. We decided to locally fabricate post-mastectomy bras. And the conditions for having the bras for us as an NGO was that the individual will send a picture of the breast or the site that she has lost, because we realized that someone will say, I need a post-mastectomy bra right side, and it turns out to be left because he or she is facing the mirror or backing the mirror while informing us. We saw lots of gory pictures that gave me sleepless nights. And I said to myself that as long as God gives me breath, breast reconstruction has to be a reality in Nigeria. So please, can you point us in the direction? Who do we go? Whose door do we need to knock on? At least to restore the dignity and sanity of the young patients. Now we are hearing testimonies of patients who have achieved fertility after breast cancer treatment or breast cancer treatment. For such patients, can we put back some form of self-esteem and give them some artificial breast? You know, it will encourage them to live longer, I'm sure. What do you think?
I think you're exactly right. You know, I had a mastectomy and decided not to do reconstruction, but I'm older. I've had my children. I had my husband. I don't need to worry about, you know, is a man going to love me? Because, you know, breasts are big things for men, you know. Young women definitely, you know, should have the opportunity for reconstruction. It is critical to them even being able to go back out in the world and feel like they have something to live for, you know. So there is one organization, and I think is called Force. Again, I will get that to you. You need to give me maybe your email on the chat or something.
I will say.
And their focus is only on young women with breast cancer, young people, survivors. And I think if anyone is going to take up the torch for what you want, which is all young women should have the ability for reconstruction, it would be them, or they wouldn't know who would. So I will put you in touch with them. And in regards to reconstruction, the important thing is having a surgeon that knows how to do it, you know, that knows how to put in implants, which is the most simple way of reconstruction. All the other reconstruction techniques, the flap, which is bringing tissue from behind forward, or the bringing tissue from the stomach upwards, that requires even more specialized training. So, you know, you have to go to a place where there are surgeons that know how to do it. Most people and most general surgeons will know how to do a mastectomy, maybe not so good, you know, because I have seen very bad mastectomies with terrible scars, but they get the cancer out, and that's the goal. But for reconstruction, you want to have someone that knows how to do it.
All right. Thank you very much. I appreciate you, Dr. Corral. Thank you. I have to let you go, but I don't want to. I have like more questions.
So you're going to send me your email or something, right? So I can get back in touch with you, right?
you. I appreciate you.
You're welcome.
Bye.
Bye.
Over to you on the physical space.